Assalamu alaikum and welcome to Imaging Experts of Pakistan. Today we have got our honored guest, Mr. Amjad Safavi. Assalamu alaikum and welcome to the Imaging Experts of Pakistan, sir.
Walaikum salam. Thank you for having me.
Whatever I would say today, it will be very little in your introduction. I would like if you give your introduction to our listener, please.
Absolutely, sure. My name is Amjad Safi. I'm a radiologist. I work out of Illinois in the US. I've been out of training for about 22 years, and I was trained here in the United States, and I do general radiology plus I do interventional radiology. I did my residency in the United States in the Chicago area, specializing in interventional radiology. And after 10 years after private practice, I started my own teleradiology company. And so I've worked at many, multiple large institutions and small hospitals over the years in the local area.
Sure. So today we'll discuss about the working relationship between the radiologist and the radiographer. So first of all, I would like to ask, as a radiologist, what do you think is the importance of the radiographer in your eyes?
Yes, yes. The radiographer is absolutely an extension of the radiologist. He is the person that the radiologist depends on to do the work. And the radiographer and the radiologist have to have a strong bond and understanding and a relationship between the two to make the best work happen, including the best diagnosis. So they're hand in glove. They'll go together. They work together every day, and their relationship is very vital.
Okay. And what are the expectations of radiologists from a radiographer?
Well, as you know, the radiographer does imaging. Also, the radiographer interacts with the patient primarily to get the history and to also sometimes looks at the patient and examines sometimes the patient where the pain is, where the point of concern is. He can often have access to the patient directly to get the exact complaint, as opposed to a radiologist who's working in the back office, reading x-rays or other studies. And so as much information that is provided by the radiographer, that becomes very vital to the radiologist. So in that sense, the radiographer is the eyes and ears of the radiologist.
Okay. So I will continue the same question, like what should be the working relationship or coordination between the radiographer and the radiologist in the department?
So the radiographer and radiologist, they work together. They have to have open communication. They have to understand each other well. They have to be cordial. They have to be friendly. They have to know each other. If there's anything that the radiologist prefers to do in a certain way, the radiographer has to know that. Plus, the radiographer has to be, the radiographer has to have solid foundation in knowing how to image cases, how to image the study, how to take the images, proper positioning, proper history taking, proper documentation and forms. The relationship, of course, is vital because it has to be open communication. If there's any questions going back and forth, those have to flow freely without any hesitation. And I believe that although not all the time, but almost all the time, the radiographer, the radiologist should have direct contact and direct communication with each other to help solve the individual cases that come all day long.
And how do you think we can create a good working environment in the department?
Of course, I mean, that comes from the radiologist and also the management and also the radiographer is a vital part of that team. As long as we have a supportive environment for the radiographer, plus we also have a mutual respect and mutual understanding for both sides, and support from the management, making sure that everybody's knowing their roles and their responsibilities, that makes the workflow much better. It is vital that that both the radiographer and radiologist should not operate separately, even if they're in different locations, even if they're virtual, and even if they're in different locations, they should have a phone call relationship or a messaging relationship. And radiographers should feel comfortable asking the radiologist, is this okay? And the radiographer should make an effort to communicate with the radiologist, because radiologists are busy people and radiographer is a busy person as well. But radiographers should have enough initiative to ask the radiologist, is this an adequate study? What else do you want me to do? Is this covered? Is this area covered properly? Because sometimes the radiologist can point the radiographer into the right direction. Plus, the radiographer can point the radiologist and sometimes in the right direction as well. So it's a back and forth. Of course, and if the radiographer has any hesitation in contacting the radiologist, not barring that, of course, and depending on the environment of the workflow, but there should be free access and free communication from the radiographer to the radiologist. There shouldn't be any impediments or any roadblocks in that communication, because the radiographer supports the radiologist, and the radiographer has to work under the supervision of the radiologist to make sure that they're taking the proper images. And if they don't know, they have to ask the radiologist to make sure that they're doing the right test, kind of exam. Many questions that come up on different tests, and I get those questions all the time. That's part of the routine work for every radiologist. And from the first standpoint, they should approach radiologists. And if there is any difficulties, I think those should be smoothed out in terms of how to communicate.
Okay. And what advice or suggestion would you like to give to the radiographers or the radiologists from our platform?
Well, for the radiographers, advice from the radiologist is make sure your foundations are strong, make sure your anatomy is well-founded, your body parts, the body parts, the type of exams. There's also workflow-related issues, making sure that you know the workflow inside out, making sure that you're labeling the studies properly, making sure you're putting the markers on the right side, making sure you're giving the proper history and presenting everything possible to the radiologist. In the US, we work with the ultrasound technologists. I know that overseas, the ultrasounds are done by the doctor, but here, ultrasounds are done by the technologist as well. We're very dependent on the technologist to do our work. So making sure that your images are complete and try to produce the best images possible. And if for some reason they're limited, you have to put the reason down why they're limited. The patient was moving, maybe the patient was obese. All that has to be documented.
Perfect. Thank you so much. Thank you so much for your time. Thanks for joining us at IIP. And we are going to end this episode here, and soon we'll come back with another episode. Thank you so much.
Thank you so much for having me.